Welcome to the Leadership Corner. My name is Ki Liu, and I am the Executive Director for the Disaster Resilience Leadership Academy at Tulane University. The Leadership Corner is a forum where leaders from the non-governmental organizations, United Nations, local and national authorities, and other stakeholders can come together to share their experiences, their insight, and their motivations to provide support to individuals and communities affected by natural and man-made disasters. Our guest today is Dr. Gary Lum, who is the Assistant Secretary for the Health Emergency Management Branch in the Australian Government's Department of Health and Aging. Dr. Lum also serves as the Incident Coordinator for Australia's National Incident Room, a government entity that is activated in times of health emergencies. Most recently, the National Incident Room was activated in response to the H1N1 virus. Prior to his current position, Dr. Lum served at the Royal Darwin Hospital, where he was acting general manager during the time of the Bali bombing evacuation operation of 2002. He was later honored by being appointed a member of the Order of Australia for his service during this operation. As Assistant Secretary and Incident Coordinator, Dr. Lum has played a key role in the adaptation of Australia's health management plan for pandemic influenza, and specifically in the government's development of a new phase of the plan called Protect. Dr. Lum, welcome to the Leadership Corner.
Hello, Keith. Thank you very much for asking me to participate in this interview.
Thank you for participating. Dr. Lum, you studied medicine at the University of Queensland, and you begin your medical career working in clinical microbiology and pathology. What brought you from clinical practice to working for the Department of Health and Aging?
Keith, that part of my life during medical school, I put myself through by working in a pathology laboratory, and that basically guided me to wanting to work in laboratory medicine. I've always had a keen interest in the clinical side of medicine, but being attuned to microbiology and pathology brought out in me the desire to not just look after patients at the bedside, which is not always possible from the laboratory, but also to manage, oversee, supervise, and basically run a pathology service or a microbiology service. And that's what I trained to do as part of my medical and specialty training. And that's what I did when I was in Darwin for 12 years as the Director of Pathology Services and the Supervising Pathologist for the Northern Territory Government. My subspecialty is in microbiology, so it gives me a particularly strong interest in infectious diseases and in microbiology. And because I was also a member of the Public Health Laboratory Network, which is a group of laboratory directors, pathologists and medical laboratory scientists that were brought together by Australian government nearly 12 years ago now to act as a forum, to act as a group of experts to provide advice to Australian and state and territory governments around public health laboratory issues. I was Deputy Chair for 3 years and then Chair for 3 years, and during that time I developed a really strong relationship with colleagues in Australian government, and it got to the point where I felt that my time in Darwin had come to a close. I'd achieved probably as much as I was going to achieve in leading the pathology service there, and I felt young enough to take a change in my career. So I'd always been interested in bureaucracy, and I thought that if I worked in Australian government, I could make a difference at that high-level government end of things. And so I made inquiries with various senior executives within the Department of Health and Aging in Canberra, and they were receptive to the idea. So I formally applied for a position, went through the formal interview process, and was fortunate enough to be appointed as an Assistant Secretary within the Senior Executive Service of the Department of Health and Aging. And since then, I've been able to utilise my skills as a medical practitioner and also as a pathologist to oversee and manage a group of fantastic people that I look after in my branch and who work with me to accomplish the goals and the missions that we have from a health emergency management perspective. Having, as you said in the introduction, worked as the acting general manager for Royal Darwin Hospital in 2002 during the first Bali bombings, gave me an insight into managing large numbers of people and also into managing to some degree a large health emergency. Darwin being in sub-equatorial Australia and being prone every year to severe monsoons and tropical cyclones, we would go through an annual preparation cycle. Having also been involved in some preparation for the year 2000 Sydney Olympics through the Public Health Laboratory Network, and then with the awful events that you guys suffered on the 11th of September 2001, and then of course with the Amerithrax Bacillus anthracis letters a month or so after that, Australians became very attuned to terrorism because of the close relationship with the United States of America. And from a pathology microbiology perspective, we were very interested in the activities related to those letters, and we likewise received many thousands of hoax letters and also many thousands of investigations because of white powders and suspicious substances, and that sparked a strong interest not just in clinical microbiology but also in biothreat, bioterrorism, pathogen security, and that's also what partly led me to desire a change in what I was doing and make a move to Canberra, where I have to say the weather is significantly different to sub-equatorial Darwin, and here I am. I'm sorry for the long-winded response, but that basically summarises, I think, why I made the move.
As a follow-on question, I know it's always difficult to compare and contrast leadership styles, especially when we're comparing the differences between the public and the private sector. But based upon your experiences in Darwin and your leap into the bureaucracy, can you perhaps compare and contrast some of the different styles that you have noticed?
Yes, definitely. I've always seen myself as going through my formal education to become a manager and not necessarily a leader. But when I was in Darwin, I was exposed to a number of people who, while they were also trained in management, they were born leaders in many ways. And I think that while you can be born a leader, you can also develop leadership skills. And I certainly took on board some of the traits and also modified my own behaviour and tried to turn myself into somebody who could lead as well as manage, as well as oversee a body of work. And so I was exposed, fortunately, and was mentored by a number of people in Brisbane, where I did my initial training, but mainly in Darwin, where one particular individual, Dr. Len Nataris, who at the time was the medical superintendent and who had a military as well as academic history background to medicine, provided me with the mentoring to become a leader.